A patient in the intensive care unit who was stable earlier in the shift is now showing subtle but concerning changes. No single alarm is screaming, but experienced nurses know that when multiple systems begin to drift at the same time, the situation can deteriorate rapidly. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. Multi-organ failure does not begin with total collapse. It develops when one failing system places stress on others, creating a cascade the body can no longer compensate for. This case focuses on how nurses recognize that cascade early and respond before recovery becomes impossible. Imagine a 68-year-old patient admitted with severe pneumonia who required ICU monitoring. Over several hours, oxygen requirements increase, urine output declines, blood pressure becomes harder to maintain, and mental status worsens. Individually, each change may seem manageable. Together, they indicate systemic failure. At the bedside, the nurse reassesses using a structured approach. The airway remains patent, but breathing is labored despite increased oxygen support. Circulation is compromised, with declining blood pressure and reduced urine output suggesting poor perfusion. Neurological status is altered, signaling reduced oxygen delivery to the brain. Multi-organ failure occurs when prolonged hypoxia, infection, or shock overwhelms the body's ability to maintain balance. The lungs fail to oxygenate effectively. The kidneys reduce urine production. The cardiovascular system struggles to maintain pressure. Each failure accelerates the others. The nurse recognizes that this is no longer a single organ issue. Continuous monitoring is intensified. Vital signs, urine output, mental status, and laboratory trends are reviewed together, not in isolation. The healthcare team is notified immediately with a clear summary of changes. Interventions focus on support rather than cure. Oxygenation is optimized. IV access and infusions are reassessed. Medications are administered as ordered to support blood pressure and organ perfusion. The nurse monitors response closely, knowing that improvement in one system may take time. This case highlights a critical nursing responsibility in the ICU. Nurses are often the first to recognize when a patient crosses from instability into systemic failure. Waiting for definitive confirmation delays life-saving escalation. The NClex approaches situations like this by testing prioritization and recognition of instability. Questions often describe multiple abnormal findings and ask which patient requires immediate attention. The correct answer is usually the one showing failure across more than one system. In real ICU practice, nurses manage complexity by staying organized, communicating clearly, and reassessing continuously. They understand that stabilizing one parameter does not mean the crisis has passed. Vigilance remains constant. Multi-organ failure also carries emotional weight. Nurses support families, explain changes honestly, and maintain dignity in care even when outcomes are uncertain. Technical skill and human presence are equally important in critical care. This case demonstrates the highest level of nursing judgment. Recognizing patterns, acting early, and coordinating care can slow or reverse deterioration. Even when recovery is not possible, nursing actions shape the quality of care delivered. Now that you have explored how nurses manage multi-organ failure in the ICU, you have reached the point where foundational knowledge, clinical judgment, and real-world readiness come together. From here, nursing is no longer about learning isolated topics. It becomes about thinking clearly, acting responsibly, and growing continuously in practice. And that is the core of everything we build here at the Learning Studio.